Could the frequency of ejaculation actually influence your prostate health? In this video, we'll look at what research says about how often men should ejaculate and how it may help lower the risk of prostate cancer. Before we dive in, let's take a moment to understand the prostate itself. This small gland sits just below the urinary bladder and surrounds the urethra. Its main job is to produce prostatic fluid, which helps nourish sperm. You can think of it like a tiny factory that's constantly working to create this essential fluid. We also have to understand why ejaculation frequency even matters. One explanation is known as the prostate stagnation hypothesis. The idea is that regular ejaculation may help flush out the prostate, clearing away old cells, toxins, and inflammatory substances that could otherwise accumulate. Think of it like cleaning a filter. If debris builds up over time, it can cause problems. Similarly, when these materials linger in the prostate tissue, they may contribute to inflammation or cellular changes that could increase the risk of prostate cancer. Regular ejaculation may help reduce that risk by keeping the gland clean and active. Some studies also indicate that men who ejaculate more often may experience higher testosterone levels. Since higher testosterone is linked with a reduced risk of prostate cancer, this may provide an additional benefit for prostate health. So how often should men ejaculate to potentially lower their risk of prostate cancer? To answer this question, we have to look at a landmark study published in European Urology. Researchers followed over 30,000 men for nearly 2 decades, starting with a questionnaire in 1992 about their ejaculation frequency and tracking outcomes through 2010. The results were striking. Men who reported ejaculating 21 times or more per month had a significantly lower risk of prostate cancer compared to those who ejaculated only 4 to 7 times per month. The risk was reduced by about 22% for men aged 40 to 49, and around 19% for men aged 20 to 29 at the start of the study. This is one of the most comprehensive studies on this topic, showing that regular ejaculation could be an important factor in maintaining prostate health. A more recent study from southern Spain looked into this question in even more detail. Researchers recruited 456 men with newly diagnosed prostate cancer and 427 men without the disease. They asked participants about their average monthly ejaculation frequency during their 20s, 30s, 40s, and in the year prior to the interview. They divided men into 3 groups based on frequency: 0 3 times per month, 4 times per month, or more than 4 times per month. Here's what they found. Men with prostate cancer tended to ejaculate less often in the year before their diagnosis compared to men without cancer. To put numbers to it, among men who developed prostate cancer, only about 15% ejaculated 4 times or more per month, whereas in men without prostate cancer, that number was 26%. When they compared risk levels, men who ejaculated only 4 times per month had a 64% higher risk of prostate cancer. Those who ejaculated 0 to 3 times faced a 138% higher risk. Men who never ejaculated had the highest risk, 271% higher than those with more frequent ejaculation. Interestingly, this connection was even stronger for more aggressive or advanced cancers, and particularly in men who had moderate urinary symptoms combined with low ejaculation frequency. This study reinforces the idea that regular ejaculation may play an important role in supporting prostate health. Remember, while regular ejaculation may support prostate health, it's only one part of maintaining overall well-being. Screening, exercise, diet, and lifestyle choices all play an equally important role. Nothing replaces a comprehensive approach to your health. Subscribe to make sure you never miss evidence-based tips that can help you stay proactive about your prostate and overall sexual wellness.